Hello everyone, Dr. Berk. In erectious disorder, vascular problems, especially when there is a problem with the incoming blood flow, should we perform angiography? When is balloon dilatation or stent performed? Of course, I am not a cardiovascular surgeon or an interventional radiologist. I don't perform these methods, but recently this topic has been brought up a lot on social media and other platforms. And especially some doctor colleagues, I feel sad that when a topic is explained in just 20 or 30 seconds, it can mislead people. After this video went live, like this, what are the innovations related to erectile dysfunction and premature ejaculation in 2023? Are there any important studies? I'm going to prepare a video about that. I'm going to do that every year from now on. In fact, when you look at social media, it's reported that 80–90% of the information shared is incorrect. And some of this misinformation is said to come from doctors themselves. Of course, I don't know if our doctor colleagues are providing this information intentionally or unintentionally, but the information they provide can sometimes be correct. In this regard, for example, they give correct information but mislead others. In other words, it is as if we perform an angiogram on every patient with a vascular disease, that is, every patient with a problem in blood flow, put a stent, put a balloon, make a balloon, and this problem will be solved. We did this, we did that. They say, I've also seen a few videos recently where they say that urologists don't know much about this and aren't really involved with it. Treatment. I've heard some statements like there isn't such a treatment in their guidelines or recommendations. I felt sad. You feel sad when you hear it, right? What are you going to do? There's nothing else to do. That's why I prepared this video. And also, when should this be done? When do we recommend this? It's not something we don't know about anyway. From time to time, we guide patients in this matter. That's why we prepared this kind of video. Now, there are many reasons for erectile dysfunction. We've mentioned it several times. We have dozens of videos. If there is a vascular problem, because for an erection to occur, blood needs to flow in. The incoming blood needs to stay inside. There shouldn't be any leakage in the penis. First of all, it needs to be determined whether this issue is vascular. Yes, according to some estimates, it's said that around 60 to 70, even up to 80% of the cases are vascular in nature, but is this issue definitely vascular? First, it needs to be determined from one side. Okay, you've identified it. You thought there was such a thing. We immediately give medication. I've mentioned before that medications are actually both for diagnosis and treatment. So if a person experiences an erection when taking the medication, that's good. Then our regenerative treatments such as shockwave, PRP, vacuum, SPF, kürkürçe can be applied. But if there's no erection, there's no point in doing these because it means there's a more serious issue at hand. Or it means there is a venous leak. We're doing a Doppler. Actually, everything ends with the Doppler here. So Doppler, the experience of the person performing it is very important. I always say that, first of all, so in order to perform a Doppler on the penis, you shouldn't benefit from the medication at all. And the person performing it needs to be experienced and skilled in this area. If it were up to me, urologists should do the Dopplers. I do it myself. I'm quite happy. But there are also friends in the field of radiology who do it quite well. But this needs to be done properly. Because based on the result from there, will you send the patient for a prosthesis, for angiography, or will you take them back for treatment? This is quite important. There will be 2 results from there, just 6, that's all. Actually, there will be 3 results. Will he say it's normal? It will say arterial insufficiency, that is, there is a problem with the incoming blood flow, or it will say venous insufficiency, so they'll say there's venous leakage. Of course, if there's venous leakage by the end of 2023, and there is no solution in the old studies either. There is no permanent, clear, treatable solution. A prosthesis needs to be made. Now, when you say arterial insufficiency, there is a state of reduction. So here, for example, we expect the blood flow in the Doppler to exceed 35. Let's say it stayed at 30 or 25. We call this reduced. If it drops even further to 15, 20, then we can say it's a bit more serious. So then it's CT angio, meaning tomography, angiography, MRI. angiography or conventional direct, It can also be done with imaging angiography from the arm or leg. We can send them for this, but there's something very important here. The experience of the person performing the Doppler is very important here. I'm paying a lot of attention to this before sending the patient for angiography. It's not enough for the blood flow to just be low, meaning for the blood flow to only be at 15-20. At the same time, the vessel needs to widen. So if a vessel is widening and the blood coming in is low, then the blood coming from behind, which I'll explain a bit later, there might be a problem with the blood vessel coming to the penis, but the vessel isn't widening at all. If it's staying so narrow in the Doppler test, then the blood vessel cannot expand, and therefore the blood, it couldn't come in, and it couldn't come in, it couldn't come in, it couldn't come in. I'm not recommending angiography because it couldn't come in if it has decreased. That's what I thought. We're going back again. We're doing these treatments. If these treatments aren't working either, then we recommend angiography. Whatever you do in arterial insufficiency here, if there is no erection and the person can't achieve an erection to engage in intercourse, then we recommend a prosthesis. Now, here's the thing. The blood vessel of the penis, of course, all the vessels branch out after leaving the heart. The blood vessel of the penis is actually a terminal vessel. So this is our main artery inside the abdomen that we call the out. This vessel going to the leg splits into two. Let's say it's an external vessel going to one leg. And there's one that goes inside. It nourishes our internal organs. It's going to the bladder and so on. Look, the very tip comes in, and the penis is entered from both sides. Here, when there are narrowings or other problems, blockages, the blood flow will be reduced. I got this from a clinical study. It's not an image that belongs to me. In the clinical study, as you can see, there is a blockage in that vessel I just mentioned. There's a blockage, there's a narrowing. Here they first did a balloon procedure and then they placed a stent on the boy. A very good flow has been achieved. So what should we pay attention to? We'll say this. When making a decision about a procedure, there's something interesting here. Let's do this with the person performing the procedure. The person who directed this is not the same. Maybe that's the problem. In fact, in all scientific studies, interventional radiologists, cardiologists, heart surgeons, and urologists are working together. So they are conducting all the scientific studies together. That's why a radiology specialist must definitely make a decision on this. So let's do an angiography for you. There is a vessel there. Yes, let's do that. They should say that this is your problem. So the task of diagnosing and directing actually belongs more to the radiology specialists. The Doppler test is very important. So the interpretation of the person performing the Doppler test is also very important. Who will do this job? The interventional radiologists and cardiologists I mentioned earlier. The experts in this field will handle it. The success rate of the procedure is 90% and above. So the detection of the vessel there and the opening of that area with a balloon or stent has a really high success rate. Exactly. In this regard, especially cardiologist friends in Turkey are very successful and skilled. I think so. The rate of a happy sexual relationship is around 60% in the first 6 months because it's not enough just to bring blood flow there. Sometimes there are also muscles, nerves, and so on there. If there are issues related to these, then when 100% blood flow is restored, the problem isn't solved. And of course, the reason for the repetition of the work is stenosis, things like in the heart. The stents we place or the stents that are put in can get blocked. Other narrowings are also forming in other places because, when you place a stent, you haven't solved the problem. So you're solving the immediate problem there. But why did that narrowing happen? For example, because they continue with sugar, there's generally about a 40% narrowing in the studies within the first year. As a result, this method is applicable, but it's not like we should just say, hey, let's do an angiogram for everyone who walks through the door. I'm emphasizing this because it's explained that way. This is the root cause of all vascular problems. There is no such thing as let's do angiography for you, let's put you on standalone, let's go everyone. There are a lot of things that need to be done before that. And I must emphasize again that the person directing this work must be, it needs to be a urology specialist. Thank you.